Go.
Okay, male reproductive system. We're going to start with the structure that actually makes the sperm. That's the testes, but we need to look inside the testes. They are housed in the scrotum. The scrotum has to descend upon birth because 98.6 body temp is too warm for sperm to be manufactured and then to be viable. So that's why some males, if they spend a lot of time in hot tubs, they notice their sperm count went down as a result. So the testes are white because they're covered with a white coating. And then at the top of the testes, this is called the epididymis. That's to store sperm. Of course, we'll talk about the parts of the penis shortly. I got to go look at the inside. That's your copulatory organ. Copulation is a fancy word for reproductive or for sex. This tube is called the vas deferens. It's when people have a vasectomy, they basically clip this and they try to clip it down here near the epididymis. So males can still make sperm, it just doesn't have nowhere to go. Can't get outside the body. But the male still makes semen, makes the liquid part of the ejaculation. So when you're going over on the vas deferens, you pass the seminal vesicles, which are right here. The seminal vesicles secrete 60% of the fluid that constitutes semen. In there, you know, I try to break down because there's a bunch of stuff in semen people don't realize besides sperm. But the seminal vesicles secrete a substance that makes the semen sticky so the sperm just don't run out of the vagina or fall out. It also secretes some fructose because the sperm have to have energy to get to the egg. They got to pack a lunch. It's a long trip for them. And they also have a buffer because the acidity of the vagina would kill the sperm. You throw a handful of sperm in there by themselves, they're dead. The vagina is acidic enough to kill them. So that's the seminal vesicles. There's two of them. This is your urinary bladder in the male. Underneath it sits the prostate gland. The prostate gland also secretes fluid into constituting the semen. The main thing the prostate gland secretes are, again, a whole bunch of chemicals in there. Semen also has vitamin C, you know, and I asked a student that why they had vitamin C once. They said it's to keep the sperm healthy. Not really, it actually does give them a little more energy too, so for the swimming. But the prostate gland, again, secretes an alkaline buffer to help neutralize the acidity of the vagina. It constitutes about a third. So you got 60% from the seminal, seminal vesicles. You have 30% from the prostate, and then you have your 10% from the Cowper's gland that we can't see with this here. And that prostate gland, if it gets enlarged, and most males over the age of 85 will have an enlarged prostate, it puts pressure on the bladder, so they have urinary tract infections. It's painful upon urination. Sometimes they have to go at night more because of that. We're really not sure why it enlarges, but it does. And of course, prostate cancer is a problem for a lot of males. Young males, it's more testicular cancer. Older males, prostate cancer. So if we look inside, because at that point then we can't see those seminal vesicles anymore. So we're down here in what I call the sperm factories. Those are the seminiferous tubules. There are two hormones you should remember, LH and FSH. FSH secretes the Sertoli cells that specifically make sperm. And then LH, if you remember, that targets the Leydig cells to make testosterone in the male. Once the sperm are made, and you've got, males have about average of 500 seminiferous tubules. If you laid them all out, I think it constitutes I can't remember now how many feet of seminiferous tubules in there. You got to make a lot of sperm. If you have a sperm count that's too low, chances are you'll never get the female pregnant. And I'll talk more about that in the lecture. But the sperm are made here, and then they are shunted off to that epididymis here. And the epididymis's job is to store and mature those sperm. And they stay there until they grow the tail, the flagella, till they make their little, what I call their, it's not a necklace, but they have the head, they have their little acrosome, their little hat that has the enzymes that penetrate the egg, and then of course they've got their little bow tie area, the midpiece, it's called the midpiece, and that contains, of course, mitochondria, so they have energy to get to the egg. So then they'll travel up that vas deferens here, and then they will go first past the seminiferous tubules, and then they will go through the prostate gland. This right here is called the ejaculatory duct. The ejaculatory duct has picked up the secretions from the prostate gland, and then it merges with the urethra. And so then the sperm will travel down the urethra. Well, there's this little gland called the Cowper's gland. And the Cowper's gland, it's also called the bulbourethral gland. That Cowper's gland secretes pre-ejaculatory fluid. And that pre-ejaculatory fluid's job is to cleanse the urethra, to make sure there's no urine in there, there's no acidity, because that would kill the sperm. So that's why pre-ejaculatory fluid is made, plus it coats the head of the penis, or the glands of the penis is the proper term, for easier insertion into the female's vagina. So we go down through here, the penis. Now if we look, this is the glands of the penis. There are two major, what we call erectile tissues or spongy tissues, that will fill with blood to make the penis then a good copulatory organ, easier again for insertion into the vagina. You have the corpus cavernosum and the corpus spongiosum. And the corpus cavernosum is this purple cylinder-like structure, and the corpus spongiosum here encircles the urethra. And both of those are your erectile tissues. This is just your pubic bone up here. You don't need to know that. There's your rectum, just for landmarks. I think that should be it for the male.